Right, good evening, good evening. Welcome to this week's 2020 Vision, when we look at the news and see what's going on and comment about it and discuss it. You can join us in the studio. Ring in on 0208 12345 07 and let us know if you agree with us or disagree, or put your point of view. And I say us because tonight we have two guests. We have Dr. Jackie Applebee on the return visit. Welcome back, Jackie. And Jackie's a GP in Tower Hamlets, but also a member of Tower Hamlets Keep Our NHS Public. And we also have our resident right-wing pundit, as we like to call him, Councillor Paul Merry from Redbridge, but he's going to be contributing on public health. So the question facing us for the first part of the programme is, have we survived COVID? What is the state of the NHS? How's it doing? How's public health having a what sort of a go is it having? And are we actually still giving our public sector workers the praise, the acknowledgement that they were due? I should, of course, say at the beginning that yet again, Executive Mayor John Biggs, who's thanking public sector workers in the Tower Hamlets Council by sacking them and re-engaging them on detrimental contracts, has again been invited this evening. His press team hasn't responded to our invites in the last 3 months, so we assume he's got some pressing business to do. He's possibly washing his hair again. We'd love to hear from him at some point, though, and let him come on and explain the rationale of what he's doing. But having said that, Jackie, the NHS in Tower Hamlets, has it survived COVID? What's been learnt? What position is it in? Is it ready for a second wave? Are we going to have a second wave? What's going on?
Oh, lots of questions there. Have we survived it? Well, it's still very much with us, and I mean, I think a lot of people haven't survived it, and I think that's the absolute tragedy of this. I think back in March when it first hit, we were so unprepared for it across the country. But I think in Tower Hamlets, what we've done, across secondary care, the hospital and general practice, and out into social care, everyone's stepped up and done their best. And so in general practice, I'm sure patients who are watching this evening will have seen a huge change in how they contact their GP. I think most of us now are doing things on the phone and trying to keep the public safe by not bringing them in any more than we have to, even though it's died away a little bit now, and things are beginning to get back to normal. And then the hospitals, of course, just stopped doing absolutely everything apart from dealing with COVID, because that was the obviously the pressing thing of the moment. But then what that's left us with is a huge backlog of usual care. An awful lot of people have been waiting for operations, waiting for procedures, and that's supposed to be coming back online again now. But as people will have seen in the news, the cases are going up again. And I think we are probably heading towards a second wave.
Yes, I was going to ask you about that, but before we sort of get on to this possible second wave, are we ready to tackle the backlog? I mean, I'm somebody who sort of fights to get away from the NHS. I am grateful when they manage to catch me and patch me up, but generally I'm quite grumpy when I'm asked to see people. I had to spend 45 minutes once with a woman who's talking to me about carrots. Sometimes it just all gets too much to bear. No disrespect to you and your profession, but sometimes it's a bit difficult. But I'm now being summoned to all sorts of checkups and almost as bad as my landlord trying to do gas checks. It's very frequent. So I'm supposed to go in and do all that. But if there must be a big backlog, are staff actually ready for it? I know in education, staff are now coming in for the start of term, but goodness, 4 or 5 weeks ago they were so tired from teaching remotely. So what's morale like among staff?
I mean, it's not too bad. I think people have managed to have a little bit of a rest over the summer. People have actually, I mean, when I say a rest, they've managed to return back to a little bit of normality. I mean, people have actually gone away on holiday, so they will have been, that may well have been in this country, but there has been a little bit of a lull. But I think, NHS staff are always ready to do what they need to do, and that's really why I think the NHS didn't fall apart during COVID because there's no spare capacity. The NHS has been run down for at least the last 10 years. Hospitals were before COVID were operating on bed capacity, which was far too high. So there's no slack in the system. So which is why everything else had to stop when COVID came along. As to are we ready? I mean, I think what we're doing is prioritising the sickest at the moment. So we are calling people back in for their annual checkups, our diabetics, our people with ischemic heart disease, chronic obstructive, chest conditions and so on, because people do need that ongoing care. But then there's also the backlog of people who are waiting for things like who aren't waiting to be called up for those sorts of things, who are waiting for their hip replacements, their knee replacements. Diagnostic procedures for symptoms, and the public have been really, really brilliant. They've really understood, I think, certainly in the beginning, what it meant for the NHS, and they stayed away. Often I think now worryingly, people are staying away when they shouldn't be staying away. They should be coming, but of course, we're about to go into winter when all of this is supposed to be starting to ramp up again, and there is not the capacity in the NHS. There hasn't been for years, and you said I'm a member of Keep Our NHS Public. I absolutely am, and I think it should be a publicly provided, publicly funded health service there for all of us when we need it. And it's creaking. It's really creaking, and we need to defend it. We need to protect it, and we need to stop the outsourcing, which I can talk about. But
yes. Oh, well, that's a point that's very interesting. Let's ask Paul to have a word here. That's how the NHS is coping. I mean, you're further out east than Jackie and myself, but how have councils been hit, and how are they responding?
Yes, well, it's life out in suburban northeast London's probably slightly easier at the moment, but all the indications from London councils and from the local government association across the country is that virtually every local authority is struggling financially at the moment. Projection in Redbridge is that we're going to be about £50 million short on this year's budget projection, which is not going to be a pretty issue to deal with in the autumn, especially if we're having to ramp up some services again at that stage if there is a second wave and a spike in cases. So that for local government, I mean, our staff have pulled off miracles in keeping services going, on voluntarily redeploying to key jobs that needed to be done as a COVID response. A lot of councillors like me do not want to be in the position of thanking them by instituting large amounts of job cuts in the coming year. So really, we're looking to the government to put its hands in its pocket and back up what he was saying at the early stage of the crisis, that they would meet the costs.
Yes,
we shall see.
Your sentiments are not necessarily shared across Tower Hamlets, although I think our executive mayor has now followed your council's example by asking the public to sign a petition to the government for more money. So that, I think, has come in very recently. So let's hope that's successful. Otherwise, as you say, we're facing job cuts, and then fewer people have money to spend in the local economy, and things just get worse and spiral down. So, Jackie, you think there might be a second wave? I see, but surely we've got all these little local lockdowns at the moment. Are we not on top of this testing and confinement where confinement is needed, as opposed to across the board? Bolton's lockdown, isn't that good enough?
No. I mean, it's like whack-a-mole, isn't it? I mean, Glasgow's locked down and now it's not, and Bolton's now locked down, and Caerphilly, where I sort of more or less come from, that's also locked down. But we're one nation. I mean, people travel, people have to people go to work. People are being encouraged, in inverted commas, to go back to work. So what you've got now, I think, is you've got a really toxic mix of the schools going back, universities about to go back, so young people sort of from all over the country going mixing. And don't get me wrong, I think it's very important that young people get their education, but I think there are better ways of going about reopening schools, reopening universities, and then of course people are being encouraged to go back to their workplaces. And yet as we know, learn more and more about this illness. I mean, when it first started, we were told that it couldn't be spread by coughs and sneezes. It was only spread by droplets. And so as long as you were 2 meters away from someone, and that really was fine. And there was a whole thing in sort of I suppose in the health service about aerosol generating procedures, and the only people who needed to have specialist PPE, protective equipment, were people who were intubating and things like that. And as it's gone on, it's become very clear that, COVID is spread in the air, and it can spread 8 meters. And so you've had workplaces like Greencore, the sandwich packing factory, where it was, there was a big outbreak. There's lots of factories that have had big outbreaks. And as people start to mix more, as schools start to reopen, universities start to reopen, and the public start to use transport more and go back to work and mix, the cases are just going to go up again. So if we're going to get on top of it, I mean, I think lots of people like Independent Sage and more people from Sage themselves agree that we have to have proper test, trace, isolate and support systems in place. So if there is a case, they're followed up, their contacts are followed up, they're supported to isolate, because if you're working and you can't just get by on sick pay, people aren't going to self-isolate if that's all they're getting. So they need support. And if we have that in place, other countries that have done that have done better and have been able to open up their economies, more than we have. But we've outsourced our test, trace and isolate to Deloitte and Serco, which really, Serco have an appalling record in health, and Deloitte, they have no experience of health at all. Whereas public health, local public health, and I'm sure Paul will have something to say about this, has been decimated since 2010. If the billions that have been spent on outsourcing to private companies have been spent on public health and councils, we could have been doing so much better, because councils are doing better anyway, even though they have so much less money spent on them than with contact tracing. So there was
another apology just today, wasn't there, from some government minister, I think, for the testing's been too much for the laboratories to cope with. That's why we're not keeping up to the mark.
Well, they shut down all the laboratories.
Yeah, I know. Very hard to explain the logic of it. Paul, how's public health doing in Redbridge? Do you know?
Well, they seem to be carrying the bulk of the workload, as far as I can tell from the briefings I've had. I mean, the majority of contact tracing being done at a local level by the local authority public health organisations. The figures for the national telephone system did not look good when I looked at them the last. They were about 70% at best. So there were a couple of weeks ago that resources would be diverted from the national system to local, but I've not yet heard any detail on that. Whether it's going to happen, I'm still not clear. But I think it's plainly obvious that local public health organisations have got the background in doing this. They have the local knowledge. It seems blatantly obvious to put resources into them and let them get on with the job.
But doing the blatantly obvious doesn't seem to be a great skill on the part of this government, does it? And I lost the plot a long time ago. I was all right with "don't go out." I got that.
They do seem to have perfected apologising, but it'd be nice if they didn't have to apologise so often.
Wouldn't it? There. I mean, it is confusing. I mean, you may have heard Andrew Lloyd Webber today saying, look, aeroplanes are okay. You can go and sit on an aeroplane. That aeroplane can travel at capacity, but you can't come and sit in a theatre at full capacity. And I think people just don't understand, just don't follow what's actually going on.
No, the messaging has gone completely to pot now. Nobody knows what is or isn't allowed, what or why. The messaging is so confused now.
Jackie, how do you feel about the messaging?
I think the messaging is dreadful, but I think the messaging reflects what the government want to be happening rather than what actually needs to happen. So they want the economy to get going again. They want people to be flying around the world. So they say it's okay to be in an aeroplane. Perhaps they haven't got such an affinity to the theatre, so perhaps they don't think, that's so they can say that sort of thing. It is not logical, because I think they are following, as I say, what they want to happen rather than what actually needs to happen. If they listened, it's not difficult. If they listened to people on the ground, and if they listened to what we were all saying, and if they looked at countries and followed examples from countries where things were going a lot better, it would be very easy. I mean, like you say, the message is stay in. Wear a mask, don't go on public transport unless you absolutely have to, support people to stay at home. And then the wider things, I mean, I suppose if there are messages all over the tube about walking and cycling and making sure every journey is essential, fantastic, and that has good, that will help with climate change as well. But if they want people to cycle, there needs to be cycling infrastructure. So we're not either vying with pedestrians on the pavement and making them cross, or taking risks on the roads. So yeah, the messaging is really confused because they're not being logical about it.
There was a blissful moment, wasn't there, when transport levels were down and public transport journeys were down, and you could just sort of see a better world sort of slowly poking its little head up from the clouds, and could be better. And now all this stuff about you can go on holiday again because we need to get more people travelling on aeroplanes. It's just such a missed opportunity. I have every sympathy with people losing their jobs in airports, and why isn't the government just stepping in and having retraining and re-employment prospects, finding new jobs for those people to do? I've always said, if a factory worker is working on armaments or nuclear submarines and is worried about losing his or her job, give them a different job. I've never found an armaments worker who says, okay, I'd be really unhappy manufacturing kidney dialysis machines. I'd be against my conscience. So I'm sure there's things that people can do, especially with climate change technology, where it is. And of course, Brexit, where apparently we're going to need lots of administrators, millions of pounds worth of administrators, counting lorries or something. Anyway, as usual, I digress. So we all had a lovely time congratulating, clapping for, I think it was every week for 10 weeks, public sector workers, health workers. Are health workers being properly valued in the NHS? That's a loaded question, because I suspect, Jackie, as a campaign for better pay, the answer is no. What's going on with the pay situation?
Well, is the NHS valued by the public? Very much so, and the public. It was. I mean, it was really heartwarming. The first clap, I just didn't think anybody would come out, and I was inside, and all of a sudden I could hear it like a Mexican wave coming. It was just amazing, and every week people came out, and it was really, really heartwarming. But the government came out, they clapped. Boris came out, he clapped. But then now they're not giving NHS staff pay rises, and we've had pay freezes really for the last 10 years, and so nurses aren't getting a pay rise, and it's shocking really. And then people who work in social care who are really, really poorly paid anyway, and who have really borne the brunt of this pandemic, and it's absolutely shocking. And I think if the government really valued us, they can find billions to throw at their private company their private company friends, to bring in outsourced services which don't work, and yet they won't give a pay rise to the people who've really kept the NHS going, and who kept Boris Johnson alive, actually, probably.
Well, what's this bit about nurses not getting a pay rise? There was a government announcement in July that there would be pay rises, but then that nurses would not get them. I've actually had not one of our callers, but somebody contacted me before the show to sort of say, how is it that nurses didn't get the pay rise if other people got it, other workers got it? So how did that happen? I'm not
a nurse, so I'm not completely au fait with that. But how did that happen? I suppose the government's just decided that they didn't have enough money to give them a pay rise, or that wasn't their priority. And I know that nurses a couple of years ago, I think they got 6% over a couple of years, but then for a lot of nurses it actually didn't work out as that much. It worked out at far less. And also if you put that in context of the pay freeze that nurses have had, it just doesn't bring them anywhere near where they should be if they've been having even inflation-proof pay rises over the last 10 years. So no wonder they're going, that health workers are complaining about this. And of course, health workers aren't, there are lots of nurse vacancies, there are lots of doctor vacancies. You know, and I'm sure the public want the NHS to be staffed properly. But if the government carry on not paying staff properly, then people will leave, and then what happens?
Because there was that recent doctors took strike relatively recently, didn't they? That was just a few years ago. I don't know what happened to that pay settlement, other than I think it was imposed. Was that just for hospital doctors rather than GPs?
Yeah, that was junior hospital doctors. So there were all sorts of changes that were going to be imposed on their contracts, which meant they weren't going to be paid extra for working antisocial shifts, for example. And in the end, I mean, they won a little bit, but not very much. They managed to win back a little bit, but really not very much. And there was things about less than full-time training, meaning that women would lose out. So
it was not a good deal.
Yeah. No, it wasn't.
All right. I mean, do you have any contact with hospital doctors now? I mean, are we seeing fewer doctors coming through? The applications to university to study medicine still seem to be stacking up.
I don't know about hospital. I am in contact with them. I don't know about hospital, but GPs, I know that the full-time equivalent, I mean, because GPs are dropping all the time, and they dropped by over 500 last year, and they keep coming down, which is a worry. And then we're told by the government, that's fine, you know, you can everything's going to be digital now, digital first. Speak to people on the phone, you know, video consultation if you're lucky, and that really worries me, because it really it's fine for some people, but it really brings in what I call transactional care. We can't then build relationships with people, and actually seeing somebody face to face is so important, and it can't be valued highly enough, really. I mean, I don't know how much I actually get from seeing somebody face to face, and how much they get as well, but I can tell so much more than I can on the phone, or even with a video consultation. And it's those relationships that build up over years, and you get to know the whole family. And so if somebody's ill, you really have the context, their social context, and where they're living. It's not just all about you know, their illness and what that spot on their shoulder means. You know, there's far more to it, and I think we're really in danger of losing that.
You have to be careful with me. I'm quite suggestible, so I should actually have to go look at my shoulders for any spots now that you said that. But this is just my hang-ups. Yes, I mean, I've got a number of tests and checkups to have to comply with the great plan that says things happen on a 12-monthly cycle. But one of them, a tiny little one, when I was talking to them on the phone, go and see a nurse about that, see a nurse about that. Can I see the same nurse at the same time? Yes, we can move heaven and earth and get you to see the same nurse at the same time. And then there was one time I said, I'd quite like to just check up on it. Oh, they said, that's a doctor. And so now I've got to come in and see the nurse about all these other things, and then go to a doctor to check my blood oxygenation. I'm having, so anyway, there we are. If you'd like to ask Jackie anything, or to talk to Paul, give us a call, 0208 1234 and we'll find out what's going on in the NHS. And I think we probably ought to move on now to a day of action on Saturday. What's going on Saturday then, Jackie?
Okay, well, there are protests all over the country on Saturday. So, I mean, I think just look on Facebook and find out the one that's nearest to you, or you know, social media, or Google sort of NHS 15, which is the 15% that NHS workers are saying that we need to bring us up to where we should be if we'd had proper pay rises since 2010. And this isn't about it's like all of these things. And this is just Day of Action bringing it to the attention of the public, and we really need the public to support us, because the NHS belongs to all of us, and we all become patients at some point in our lives. And if we want it to be there free at the point of delivery, you know, publicly provided for all of us when we need it, we need to defend it. And the government will say they're not privatising it. They have been privatising it for years and years and years. And under COVID, they are privatising it, bringing the private sector in even more. Which is not good for the NHS, because they run services on the basis of profit. And if you just look at care homes, which have, you know, they were decimated during COVID, and they are more or less run by the private sector. At least the NHS has some level of central planning. The social care had none, and people really suffered. Staff and residents suffered because of that.
Yeah, very much so. Paul, have you got any
Yeah.
contact with the NHS out in Redbridge? Have you got any picture of how the service is managing?
Well, my focus is mainly on Whipps Cross, and it seems to be getting back to something like normal. But I was trying to get a blood test a few weeks ago, and that took a bit of an effort.
Yes.
I did manage to get my GP on a telephone call in the end, which was a bit of a relief because I had to get them to authorise my blood test. Yeah, it's all very. I wouldn't say going to GP is what it used to be. It's very strange trying to get hold of advice over the phone or on a video link. But
Well, speaking
it's
of
better than no service.
Speaking of video links, I think we might have a caller coming through. Is that right? Do I have? Hello there. Who's calling? What's your name, caller? Caller, if you want to speak to us, that's lovely, but you'll need to make sure that you turn off the sound on your phone or your laptop or computer. No, I think our caller has left in confusion. So sorry about that. Caller, do ring back if you'd like to speak. Hello? Hello, who's that?
I was trying to call in to the
Yes,
show. I didn't get any reply.
No, sorry, we were chatting along
Right.
there. Hello, Joe, you're live on air.
Sorry?
You're live on air, Joe. You just need to make sure your computer is turned down, the sound is turned down, or your phone is turned down.
Sorry, I can't hear you.
You're hearing
Hear you.
our broadcast. There's a 4-second delay. So turn your phone sound down or your computer sound down, and then you can hear us direct. Hello, Joe.
Okay. Hello? Hi.
Joe, you're live on air. What would you like to say?
Oh, you can hear me now. Great. Okay. My name's Sybil.
Yeah.
And I was just signing up to see what the panelists thought about the current the government story at the moment, which is blaming young people for the uptick in coronavirus cases, and whether they think that the increase in testing positive of young people is something that we should be particularly worried about, and whether it is actually young people who are to blame for this, or is something else going on?
Well, let's go to Jackie first of all. We were talking about young people just before we came on air, Jackie. So, and obviously we've all seen the photos, the coverage of younger people in pubs and not doing social distancing. Is that going to lead to disaster? Should we be testing them?
I mean, first of all, we shouldn't be blaming young people at all. Blaming individuals for what's happening with COVID at all. And we were talking about the messaging, weren't we, earlier? And it was the 4th of July, which is actually my birthday, so I remember it very well. And everyone was being encouraged to go out, and and it was like, the whole thing was over. And so young people can't be blamed for this. And there was the whole thing about Eat Out to Help Out. So people were being encouraged to go out all the time. And I think, so what's happening now? I mean, I don't think young people certainly can't be blamed for the uptick in cases. I think that was going to come anyway as people started to mix more. I mean, I think everybody started to mix more because that's what we were told we could do. The virus is very much still out there, but that wasn't the messaging really was. I think people more or less felt that it had gone and that we'd beaten it. And I think people did really, really well. I mean, people locked in for 4 months almost. And it was nearly 4 months, wasn't it, where people just really sort of cooperated and sort of gave up their sort of civil liberties and so on, because they really understood what this meant. And like I said right at the beginning, I think the public really understood what it meant for the NHS and stayed away, and many people stayed away when they probably shouldn't have done and need treatment. So I think the blame for the uptick partly because COVID is a virus and you can't completely get rid of it, partly because government policy has been absolutely woeful. They've been, in my opinion, they've been incompetent. They haven't listened. They haven't done what they should have done, and they certainly haven't done it in a timely fashion. We saw COVID coming from January. We had about 10 weeks. We saw it come from China. It came through Iran, Italy. We had about 10 weeks to see what was happening, to learn from other countries. And yet we didn't. And Boris Johnson was out there shaking hands with people in hospital in March and bragging about it. So no, don't blame young people. Blame the government. They need to listen. They need to listen to the evidence. They need to listen to the people on the ground.
Paul, what do you think? You've got a couple of young people around at the moment. What are you thinking about how they're responding to the pandemic?
Well, I mean, the rise in infection rates amongst the under 30s is worrying. But really, I mean, it comes down to the test and trace system and reinforcing the messaging about social distancing. I'm quite frankly amazed at how well behaved most young people have been. I'm not sure back in my years I would have been as disciplined and well as most have been. I mean, after months and months of lockdown, it's hardly surprising that they're socialising slightly more at the end of the summer when the messaging is that, you know, everything's easing down and you can get back out and about again. I think it's a case of keeping an eye on figures and you know, taking the messaging, especially with kids going back to school and young people going off to university from here on. So you know, the test and trace system is going to be vital at this stage. So let's hope that it works.
And the messaging is not only confusing but also quite off-putting for young people, isn't it? With all this talk about how many of them are going to lose their jobs or not be able to get into work. There must be a point at which young people say, well, why bother? To an extent. What do you think about young people, Sybil?
Well, I mean, I agree with both of the speakers, but I am really worried that from my contacts in teacher unions in particular, I'm a retired teacher myself, that the plans for what will happen if there's an outbreak in a school, I don't know the situation in Hamlets particularly, are pretty unclear. And the idea that you can have a bubble of a whole year group, which is actually up to 350 kids, being the only people you're in contact with, and then if one of them is test positive, then what happens? It all seems to me to be extremely ill thought out, and actually, you know, as an older person, it feels quite threatening to me, the whole situation. No, I certainly don't blame young people. I have young people around me, and they all behave extremely well, and most of the ones I see outside are behaving well. But it is a concern, and I think the general sort of let's all get back to school, and the most important thing is get back to school is a bit worrying, actually.
Brilliant. Thank you. Well, thank you very much for your call, Sybil. That's very interesting. Extra point. Thanks. Bye. And I mean, certainly, I suppose more at the primary end, where children are possibly more biddable, I suppose it can be very difficult because school, we have to face it, it's childcare as well, isn't it? So it's really going to affect people, parents who think they can go back to work, and then if a school's locked down for a fortnight, they're not back at work again. Who knows what's happening? Right. I think we have a second caller. No, we don't have a second caller coming through. I'm watching the delayed version. Watching two things at once. Okay, so Jackie, we've talked about there's protest actions happening throughout the day on Saturday, and also Hamlets Keep Our NHS Public has got a meeting on tomorrow. You two in a row. What's your meeting about tomorrow?
Oh, well, I mean, we have a monthly sort of organising meeting anyway, to talk about what's going on locally and to talk about how we're going to intervene in that sort of thing. So, I mean, anyone is welcome to come along to that. The more the merrier. So I think probably tomorrow we'll be discussing Barts Health have got their AGM coming up. So we'll be probably discussing intervening in that.
Oh, good. Yeah.
Because there's, I mean, Paul mentioned the new build at Whipps Cross Hospital, and I think there are going to be 51 fewer beds in that hospital than there are in the existing hospital. And when North East London is going to be growing by about 300,000 with all the sort of development that's going on here, we need more beds, not less. And COVID has shown us that there isn't the spare capacity. So we need more beds, not less. And now that we have, but certainly Bart's Health Trust stretches from Walthamstow through Newham and into Tower Hamlets. Anything that happens at Whipps Cross knocks on all across the three boroughs and beyond.
Yeah. Yes, I think some Tower Hamlets patients are also referred to Whipps Cross as an option.
Yes.
I'm not sure. Whipps Cross I could just about cope with. The thing that got me was when we were referred to Bart's. That all seemed to be very, very far away. But there we are. Yes, I'm just looking. There seems to be maybe it's a national meeting then, because there's definitely a meeting. What's going on? Fair pay for frontline workers, Wednesday the 9th of September, 7 till 8:30.
Okay.
So there's that meeting as well. So we've actually put details of the meeting on the vodcast Facebook page in the comments. We're just showing them now. I think they're a bit small. Well, I know they're a bit too small to expect people to read them on screen. But if you go to the vodcast Facebook page, which may well be where you're watching this, then you can also see the details of all the meetings coming up. And there's also an article on East London News. It's the last but one article to have been posted, so you can go to that website and check out the details there. Okay, so lots of actions coming up. I hope that we've given them something of a plug. Jackie, is there anything else that you'd like to say to the audience in Tower Hamlets and East London about the NHS, what's going on, and what we can all do to support our NHS?
I mean, first of all, I'd like to say thank you to everybody in East London, because I think COVID has really shown how people can pull together, and I think we really have done that. And I think all the sort of mutual aid groups that got set up and how people got to know people in their communities and how people supported each other was fantastic. I think the NHS is in peril. I think the fact that we coped with COVID was because everyone was very focused on COVID, and NHS and social care workers. We mustn't forget social care workers who really did bear the brunt. And I think in Tower Hamlets, for a lot of these people to be being faced with Tower Hamlets rewards and being sort of made to reapply for their jobs on worse terms and conditions is shocking, because they're some of the lowest paid workers. So support your social care workers as well. But as far as the NHS is concerned, it is being privatised hand over fist. If you just go on and you see how many private companies are now involved in providing care in the NHS, we need the public to get involved and to fight for the NHS as it was intended in 1948. It was supposed to be, it was born out of the ashes of the Second World War, and if we could afford it then, we can afford it now. The government are always saying we can't afford it. We can afford it. It's very, very cheap, actually. It's one of the cheapest healthcare services in the world and one of the most cost effective. And if we want to keep that, and I emphasise we're all going to be patients at some point, we have to work together to insist that it's that's what it reverts to.
And I think we just have to be careful. Just have to hope that we don't get a big second wave. I'm sure people will rise to the occasion if we do, but the effect then on the economy, the effect then on young people, and the effect on our health services is just going to be immense, isn't it? It's difficult to work out if the government is trying to prepare us for a second wave or trying to reassure us that there's not going to be one. It's almost business as usual. It's very difficult to work out, isn't it?
But fundamental to controlling a second wave is a proper test, trace, isolate and support system. They have not got a proper test, trace, isolate and support system. They've got this ad hoc national thing, which really isn't cutting the mustard at all. Local communities, local public health departments and GPs. I mean, GPs were cut out of looking after COVID and dealing with COVID. The results of the tests don't come back to us. We are all crying out to actually look after our own populations with our with our public health colleagues. That's where the focus needs to be: community directed, test, trace, isolate, and support also being absolutely vital. And as for testing, it was interesting. I meant to say this when Sybil was talking about is are we seeing more tests or more positive cases because there's more testing? There are always shortages of the testing reagents, so now people are really struggling to get tests again. The whole thing is a fiasco, and it needs to be dealt with locally.
Yeah, and all they've been successful in is using yet another public service to take public money and shove it into private pockets, really. So, okay, well, now we've cheered ourselves up.
Sorry.
It's inevitable. Jackie, thank you for coming back. Was that Paul?
You got to look on the bright side.
Yeah, absolutely. That's what we do every week. So, Jackie, I'd like to thank you for coming on as our guest this week and updating us on the scene in the NHS. And we've been able to air some of the Keep Our NHS public events that have been going on. So hopefully people will follow that up either by Googling them or looking at East London News or at the podcast comment section. But as you are one of our valued NHS workers, Jackie will let you go now and
thank you.
Get ready for some more care this morning. But thank you very much for joining us. Paul, you can stay with us, but from now, goodbye to Jackie.
Pleasure. Goodbye, everyone. Thank you.
Bye. Okay, so Paul, what else is going on in your neck of the woods then? What's the council been up to in Redbridge?
Oh, well, thankfully it's been reasonably quiet over August, being the holiday break. I did manage to get away for 4 days into Suffolk, which was very quiet, very dog friendly. Being Redbridge, we've been doing some enforcement. Very keen. We've closed down. We've taken enforcement action against a couple of restaurants and bars that have been overdoing it with not sticking to the guidelines. Apart from that, it's really been. I mean, local government terms, it's just cranking back up again now. So I mean, obviously the big question is, on the financial front and. How much of a second wave are we going to have to cope with? I mean, I'm glad to hear what the doctor said, because basically I wouldn't disagree with anything she said that I've seen from a local authority point of view.
So it comes down, it's all about the money.
Ultimately, it's all about resources and money. Yes, you can only do so much for nout.
Yeah. And it's not as if councils were sitting on massive reserves either, is it? So
no. I mean, our reserves would get us through about a year. If we blew them all, they'd keep us going for a year, and that'd be it.
And it's very difficult sometimes to understand what's going on about with reserves, because of course some of the money held is earmarked for certain purposes only. So sometimes it can look as if a council is sitting on more money than it actually has. I'm just looking through your Redbridge Council website at the moment. I see your AGM has been deferred.
Yes,
and you're encouraging parents to get their children back to school.
Yes, as long as it's a difficult situation. I mean, I don't want to see kids denied an education. And we've had months of this now, but schools can only reopen if there's a proper phased return in place and proper social distancing methods and the ability to test staff and pupils on a regular basis. I'm not sure that is there in a lot of places at the moment.
Well,
but we will see.
One thing we have seen with on the action on behalf of on the part of councils is messing around with roads, but sometimes in a good way. There's been a lot of work in many of East London's boroughs, widening pavements so that people can get through to public transport areas, but stay socially distanced, and more space for bikes as well. And I see that Redbridge has a scheme called Quiet Streets. What's that all about? Is that helpful at all, or is it a load of old tat way of wasting money?
I hope it's going to be helpful. I mean, to give them the due, the government did make a certain amount of money available for COVID-related transport issues, and money has come through from TfL. It's mainly TfL money that's going into the Quiet Streets programme down in the Ilford town centre area. It's modelled largely on the Waltham Forest Mini Holland's scheme, so it's mainly cutting off rat runs and stopping short distance commuting, trying to encourage people to walk, cycle, scoot, or otherwise go to the local shops in anything other than their motor vehicle. The interesting thing is it's been introduced under emergency traffic legislation, so it'll be banged in and then adjusted as and when the responses come back from the public. So it's all done on a temporary basis using the sort of planters and street furniture in the way, so you can juggle it about and so on. But I mean, it is a genuine attempt to try and reduce congestion and reduce emissions and pollution at the same time.
Well, we've had a bit of that in Tower Hamlets, with council workers scurrying around most of the schools in the borough over the course of August and widening access points and taking out, those gates that used sort of railings that used to sort of try to pen children and parents into very small thoroughfares, and taking those out, and as you say, using planters to increase the space and various sort of road changes, one-way systems and so on. So a lot of stuff has happened around outside schools, but of course in Tower Hamlets we've also got this other thing that I really haven't really got to the bottom of yet, which is this thing called, it's very difficult to say, livable streets. That's streets that you can live in. You are able to live in the streets. They're more prone for life. They're better to live in. That's the idea. Of course, whenever councillors talk about it, they tend to say Liverpool Street, and everyone thinks they're talking about Liverpool Street and wondering why we're sort of focusing on something just outside the borough. But I'm really not quite sure what's going on, because there's a lot of Barney about it, with some people saying, cutting off. I think we've cut off every rat run there is in Tower Hamlets already, and now we're sort of interfering with people's sort of proper routes, homes to shops and homes to relatives, and getting out of little corners of Tower Hamlets to be able to make an onward journey. But on the other hand, there are some people who are saying it's a very good scheme. It's going to cut down on air quality in that. I don't know, but that seems to be in addition to what you're doing.
The immediate problem is that because public transport use is so reduced and people don't seem very keen to get back on it. I've been on the bus twice since lockdown started, and it was fairly quiet, but people still don't seem to quite know how to use masks. But because people aren't using public transport, if people are going back to work and dropping kids off at school and so on, the levels of road traffic are getting to such an extent that it's going to gridlock in a lot of areas. So we're going to have to do something to try and reduce.
That might be why the air quality is so bad, because we're making it so hard to travel that the place is full of idling cars. Remember, you remember the Blackwall Tunnel, don't you? Just north of the Blackwall Tunnel, that area of East India.
I know it so well that I went down it on Sunday, going to dropping one of the kids off at a cricket game in Bromley.
And what did we do in 1994 when there was a new Labour council in Tower Hamlets? We cut off the rat runs through that part of the area we call Lansbury. And it lasted for 20 years, a bit longer. And then a few years ago, Poplar Harker decided to open up all the routes again. And now there's just standing traffic every rush hour as people try to cut through to find an easier way onto the motorway. So it's really...
Well, I try to limit my experiences in the Blackwall Tunnel to twice a year, really, at maximum. I wouldn't say my most enjoyable journey ever undertaken.
No, indeed. Right, well, but as an attraction, we all Yeah, it's this is the point, isn't it? Because so much of our traffic in East London comes from people travelling across East London rather than making local journeys. You worry if the right people are actually being penalised. But there we go. I see in passing that Sadiq managed to get out to Newham this week, and he and
did I see him with Mayor Roxy at some do or other?
He was out with Mayor Roxy at a social distance from her, and they were encouraging people to take more tests, which perhaps that accounts for why the logjam in testing has occurred and the entire system has failed. Who knows?
Let's not blame it entirely on poor old Mayor Sadiq and Mayor Roxy. But it has been worrying watching news reports of people being told to go to Northern Ireland and Wales and East Anglia for tests. I mean, we really have got to sort this out, because without the test and trace system, it is going to be a disaster. So,
well, I know you won't approve, but we do usually in East London news circles refer to him as Mayor Sadiq Khan the Vandal, after his opening up of a dual carriageway through Fish Island, or something equally unnecessary, at vast cost to its cultural heritage. But there we are. So in terms of extra roads through the area and extra through traffic, he seems to be right on up there. There we go. Great. Well, let's draw this evening's proceedings to a close. We've looked at a little bit at East London and its public sector workers and whether they have survived the COVID crisis. Do join us next week, because next week we are going to be going what for East London folk is almost international. We're going to be going up to the Midlands, and we've got a special guest, very special guest from the Midlands, and we're going to be looking at the Commonwealth Games, which are supposed to be coming to Birmingham, and which are being seen as a major opportunity to actually correct some of this economic nonsense that's going on at the moment, a way of offering new jobs and boosting the economy. But who's benefiting from that boost? And it's the diversity in how the jobs are being allocated. That's what we need to look at. And I shall just leave you tantalised that we have a special guest from the area who will be joining us, and we'll be trying to see if, again, we can suggest some more sensible ways forward. So, Paul, with your West Midlands background, I'm very much hoping that you'll join us again next week, and we can have a three-way discussion about regeneration and diversity, and how to make sure jobs are shared around and everyone benefits from economic improvement, rather than putting all the money in private pockets.
Maybe they can draw on our experience from the Olympics.
Absolutely, that's yes. Hopefully, I think the Commonwealth Games are supposed to be a bit smaller than the Olympics, but I think most of us are quite underwhelmed by the Olympics. So we need the Commonwealth Games event to go a bit better for our colleagues in the West Midlands. So join us next week as we look into that. But for the moment, you haven't any pressing things you've forgotten to say, have you, Paul?
No. I'm just happy to be still awake at this time of night.
Oh dear, you lightweight. Okay, lovely. Well, hopefully we'll see you again soon, Paul, and viewers. Hopefully you'll come back again next week. As I say, we'll talk about something quite different. There's a little earthquake happening on the Isle of Dogs. Right. Okay. That's it. Thank you very much, everybody. Look at East London News for those meetings about the NHS, and we'll see you next week. Good night.
Night.